Now, the results of a new clinical trial published in the New England Journal of Medicine show that immediate Kangaroo Mother Care, which involves skin-to-skin contact with the mother and exclusive breastfeeding, started as soon as a preterm or low birth weight baby is born, dramatically improves survival. This new study suggests that when compared with the existing practice, starting Kangaroo Mother Care immediately after birth can save up to 150,000 more lives each year. Love FM's Kwesi Deborah has been speaking with the Ghanaian collaborators in this study.
The study planned to include 4,200 infants, but was stopped early due to clear evidence of benefit on survival. The School of Public Health, KNUST and a Konfanoche Teaching Hospital were part of this study.
My name is Dr. Jikua Planjul. I'm the head of the mother-baby unit at the Konfanoche Teaching Hospital, and I'm also a lecturer in the School of Medicine and Dentistry. The whole idea of Kangaroo Mother Care came about probably 10-15 years ago. It actually began in a hospital where they didn't have power, and so they decided to put the babies, it was a hospital in South America, and they decided to put the babies close to the mothers, under their, close to the skin to keep them warm. And they suddenly found that, these babies were surviving. The survival was amazing. And so we began to realize that there was something about putting a baby next to his mother's skin which worked some miracle and caused them to live. And it certainly wasn't just about warmth. So, over the years, lots and lots of research has been done, and it's been found that putting babies in skin-to-skin contact with their mothers, the baby is naked, is put against the mother's bare chest, somehow makes them live. And so it became the norm, it became the practice. There was lots and lots of research done, and it became the practice all over the world. That's part of the care of the very small baby, the baby who was born too soon or born too small, was to put him next to his mother's skin. But initially, the recommendation was when the baby is born, wait for a few days. When the baby is 2, 3, 4 days old and he's stable, breathing properly, then you can begin putting him in the mother's skin. And as I said, the results were so dramatic. The babies did so well, they could breathe better, their heart rates were better, they had better temperatures, so many things. So then the question came up. But of course, in the first 3-4 days, whilst we were waiting for these babies to be stable before we would start putting them in skin-to-skin contact, a lot of them died. And so the big question was, if this skin-to-skin way of keeping babies in skin-to-skin contact works such wonders, what would happen if we started earlier? So essentially this study that has been published today was to answer the question, if this is such a good intervention, if we were to start even earlier, in other words, immediately after birth, the baby comes out and then goes into skin-to-skin and stays there as long as possible, would we have an even better outcome? So essentially, the study that was published today in the New England Journal of Medicine was designed to answer that question.
My name is Professor Sam Newton, and I'm the head of the team which organized the study. And I'm also the acting dean of the School of Public Health. What was interesting about this study is these babies were very tiny, and initially we were wondering whether it would work. It was like a proof of concept to see whether if you put very tiny babies close to their mother's chest soon after birth, whether they would do better than when we wait till they are stabilized. And the results show clearly that they do much better. The bonding is there, and for reasons which are not too clear to us, babies which you would think would not survive actually do better. So it's a good day for us. Now we know that the apprehension which people had about this intervention, seeing that the results have come out in a reputable journal showing that there is much less death or mortality in these children, will be scaled up. And then, of course, it will only be in countries, in developing countries like ours, but also in other developed countries would also take up this intervention, which would really help to save a lot of newborn lives who would otherwise have died.
Reporting for Joy News, Kwesi Deborah.
And that's how we end the AM News with me, Mapita Sibidi. For more news, you can log on to myjoyonline.com. The AM Show continues with Mama V and Benjamin.